Good morning, Noah. My name's Janie. I'm a nurse practitioner student at Purdue Global, and I'm here to perform a head-to-toe assessment on you today. You doing okay?
Good.
Doing all right?
How are you?
Good, thank you. Can you tell me your full name and your date of birth?
Noah Hardaway, November 17, 2008.
And can you tell us what we're doing here today?
I'm doing a head and toe assessment
Okay. And do you know where we're at?
around our house.
Okay. All right. And what's today? State.
Today is February 1st, 2025.
Okay. That's
Or
within.
February 7th,
Okay.
2nd, 2025.
Okay. All right. Okay. To start off with, I am just taking a look at you. You appear to be just resting here comfortably on this bed. Your breathing appears to be even. It's unlabored. You're appropriately dressed for being at home on the weekend. Clean. Your hair is evenly distributed over your head. Your eyebrows, your hair on your eyebrows is evenly distributed too. Can you look up that for me? Okay, and you've got some hair that's growing on above your lip and on your cheeks and chin and neck. It's appropriate. Your head is appropriately sized for your body size, your height, and your gender. I'm just going to just feel around on your head for any kind of lumps or bulges, any kind of just weird feeling skin, You got any complaints? If I touch anything and it's tender, you let me know, okay?
Alright.
Sorry, you got your hair all messy. Alright, so I didn't feel anything. It was pretty normal, expected findings. Looking down at your eyes, they are symmetric. They're evenly spaced on each side of your nose, which is midline. I'm just gonna palpate in here a little bit. Tell me, you feeling any pain or tenderness as I palpate your sinuses? Okay.
No.
Alright, go ahead and open your eyes. I'm just gonna pull your bottom lid down a little bit. And look at that conjunctiva in there. It's nice and pink. I'm gonna grab my little light scope here, and I'm just gonna look up for me just a little bit. In your eye, above our conjunctiva looks to be transparent. The sclera is nice and white. All right, I'm gonna look in. Can you look up a little bit? I'm gonna look into your eye with my left eye into your left eye. Okay, just look forward. All right. Reflexes in there. Okay, reflexes noted. Okay, and I'm going to change lights, and I'm going to check your pupil dilations with the light I'm just going to do each side here. I'm watching for their constriction. So I was looking I moved the light into this eye, and I was looking at your pupil constriction, and then I moved it into that eye again, and I was looking at the constriction of the other eye, and it was equal. Okay. All right. Okay. Can I get you to not move your head, but to move your eyes? And I'm just going to watch your ocular movement, okay? Alright, your accommodation is good too. Does that make your eyes feel weird when I do that? Yeah. And then I'm going to check your visual field. I'm just going to kind of wiggle my hands on the outside of of me right here. And as I come in, when you can see them, just let me know when you can see them, okay?
See him.
Okay.
See him.
Okay.
See him.
All right. Thank you. Visual field is intact. And then I'm going to move on to your ears. A little otoscope. And I'm just going to feel them. You feel any kind of tenderness or pain with them? No? Okay. I'm going to look into it with my little light. And what I'm going to do is I'm just going to take your ear here and I'm going to pull it back and up, okay? So it kind of opens your ear canal for me to see in there, okay? And I'm noting that on the outside of the ear is dry and there's no drainage. And a little bit of earwax in there. Yeah. My otoscope is not the best, but I can visualize the tympanic membrane. It's really shiny white, kind of pearl white. But like I said, my otoscope is not high powered, so I can't see much of anything else in there, but I should see some bony prominences and stuff. Okay, so up and back. And again, the outside is nice and clean. There's no drainage, no blood. Your tympanic membrane is big. It's nice and shiny, pearly. This ear is much cleaner than the other one. Okay. Do you remember last time when we did the tuning fork and I put it on your forehead?
Yes.
And I put it on your forehead and you told me whether or not, which ear you could hear it best in.
Yes.
So I'm going to do that again, and then we'll do that one's called the Weber. And then I'm going to do the one where I hit it and put it on the back, and then we listened when it stopped without it being on your ear, okay? Alright, so here we go. Which ear do you hear it best in?
Both.
Okay. Tell me when you can't hear it.
No.
When you don't feel the vibration, do you hear it?
Mm-hmm.
Did you hear it when I pulled it away?
No, because it was already over.
Okay. Tell me when you don't feel the vibration. You can see
No.
it. Okay. Can you hear it?
Still hear it.
Okay. That's good. Alright.
It's not working.
I keep turning it off with my hand, so tell me when you can't feel it.
No.
Okay.
Yes.
You can hear it? Okay, perfect. Okay. So that was the Renee. And air conduction was greater than bone conduction there, so that is the normal expected finding. I'm going to grab my little light again. It's cute purple, but not amazingly high powered. And I'm going to take a look at your nose. I noticed that your nose is midline on your face. It appears even on each side. It's appropriate for, being a boy. And I'm just going to kind of look up in your nose a little bit, okay? Let me turn my light on. So there's no drainage, there's no bleeding. You do have some boogers in there though, kid. It's symmetric. No deviation at the septum. Sorry. Okay. The mucosa in there was nice and pink and moist. My light is, I'm messing my light up. Okay. So I'm going to take that off because I touched your nose with it. So now I'm just going to look at your lips. They're moist, they're not cracked, they're intact. Good size for your body, they look appropriate. Um, can I get you to open your mouth and say "ah" for me? Stick your tongue out. Can you do this? Alright, just open your mouth, stick your tongue out. Alright, I'm just looking at your teeth. And they're white, little yellow some places. And I do note that we've got some filled cavities in there. Can you move your tongue from side to side? Okay, let me do the other side. Okay. Alright. Tonsils were not enlarged. The back of the throat was nice and pink and moist. The uvula was midline. At the back of the throat, the soft palate was pink and shiny. And okay, I'm going to move on to the neck. And I'm just going to kind of feel down the neck for any kind of masses or anything. It is evenly shaped, and I'm just going to kind of move your trachea. Trachea is nice and palpable. And then can I get you just to kind of turn this way? Looks like your whole body big. Okay. And I'm just going to locate your thyroid. Okay. Can you swallow for me? Okay. One more time. Okay. Feels good. All right, you can go ahead and turn it back around. Thyroid was palpated and no bulges or masses noted. Let's see. We need to move on to move on to my lymph nodes. Okay. I'm going to palpate your preocular. Find them. Okay. And then your postocular. And then while I'm here, I'm going to come back here and see if I can palpate your occipital. Yeah, they're not enlarged. Okay. And then tonsillar and submandibular, submental. I'm going to take anterior cervical and posterior cervical. And then can you look towards the, okay. There's supposed to be the deep cervical lymph nodes in here, but not usually palpable. Okay, look towards the wall over here. Okay. And I'm just going to touch in here for the supraclavicular. Nothing feels enlarged. And then the inferior clavicular. Very light. They're not enlarged. They just feel a little. You can just fill them in there. You know, just with your tips of your fingers. Okay. And now I'm going to go to your respiratory. Remember we did the respiratory, but we did a whole bunch of different sounds and stuff. This time I'm just going to listen. I'm going to listen and then I'll palpate your lung fields, okay? breath every time I touch you. Do you mind taking your shirt off? Thank you. Okay. Listen to your back now, okay? Thank you. Alright, lung sounds are clear. It's auscultation bilaterally equal. I'm just gonna kind of palpate in here a little bit with you, okay? And tell me if there's anything that's tender. Let me get you to lay down on your back for me. I'm going to percuss your chest and then we'll move on to your cardiac and then your tummy, okay? I'll take your back when we set back up. I'm going to listen to your heart sounds. I'm going to do my diaphragm and my bell. But while you're laying there, getting it on you, I'm just noting any any heaves or pulsations from your heart through your chest wall. You okay? Okay. All right. Okay. All right. I'm going to start with your aortic valve. Your herbs point. Tympanic. And mitral. It's tricuspid, not tympanic. And that's the maximum impulse right here, which is the fifth intercostal space mid-clavicular line, apical pulse. I'm just gonna turn and do my bell in the same spots. I'm going to listen to your carotid artery too while we're here, okay? For any bruits. No thrills or bruits noted. Okay. And then now I'm going to look at your tummy or your abdomen. It is rounded. It does have some hair on it and a few stretch marks here and there. I'm going to split your abdomen up into 4 quadrants. I'm going to do the right quadrant, right upper quadrant, left upper quadrant, left lower quadrant, and then right lower quadrant. Okay, so I'm going to start out by listening to your bowel sounds, okay? Okay, go ahead and move your hand for me. Bowel sounds are audible. They're normoactive sounding. I'm going to do the palpation. Do you remember when I did, I would press into your tummy feeling? So I'm going to do the light one first, okay? Sometimes it might be a little ticklish, and it's okay. Get those little tickles out. Any tenderness or pain while I'm doing this? Okay. And now I'm going to do a little bit deeper in this upper right quadrant here. Your liver lives. So I'm going to see if I can feel the border of it by pressing a little bit deeper in there. Okay. Can you take a deep breath for me? Okay. And then I'm going to press a little deeper over here. Your spleen's over on this side. Normally, you can't feel the spleen unless it's enlarged. Your lower quadrant here, and your lower right quadrant. Any tenderness while I touch? You're ticklish, I'm sorry. Good job, good job. Okay, and then I'm gonna percuss your quadrants, and I'm gonna see if I can. I'm gonna start here in this right one. Okay. fill sounds noted, percussion. Okay, and I'll get you to set back up real quick for me, just on the edge of the bed. I'm going to just do some strength, some checking on some strength with you. Can you move your neck against my hands? Okay, the other direction. Okay. All right, do some shoulder shrugs for me. Try to press it. Okay. And can you press out? Okay. And can you press in? Okay. And can you hold your hands like this? Okay. I'm gonna try to push them down. Okay. And then push them. Okay. The rest are good and strong. Your hands are too. All right. And I'm gonna. Can you lift your leg up against my? Okay. And can you lift it up against? Okay. And can you press down? Okay. And can you push out on my hands with your knees? Okay. And can you pull back? All right. I'm gonna have to get down a little bit to get down here. All right. Press against my hands. All right. With the foot pedal right there too, and then press up. Okay. Thank you. Okay. And then I'm going to try to do this super quick neuro check that she had us watch, and my light. I'm going to skip cranial nerve 1, which is the smell, but we know that it's smell. We're just not going to check it today. Again, I'm going to check your red reflex real quick. Look straight ahead back for me. Open your eye real wide. Okay. That's a really cool look when you get it. Okay. Red reflex is noted. Okay. I'm going to check your pupils again. And looking for okay. And then again, we're going to follow my finger with your eyes only. Okay. Perfect. Thank you. Can you clench your jaw for me? Okay. Smile real big for me. Puff your cheeks. Can you raise your eyebrows? Stick your tongue out for me. Okay. Stick your tongue out and say ah. Move your tongue from side to side. Okay. Shrug your shoulders. Okay. All right. And your head side to side. Okay. All right. I think I got all of them. And all 12 cranial nerves are intact. And then I'm going to have you, we're just going to do a little bit of gross upper strength and lower strength. I think we did the lower strength already with the foot pedals. Can I get you to squeeze my finger? Thank you for being professional and taking a nap. We would squeeze them real tight, okay? All right. Yeah, you're not on me. Okay. All right, let go. Perfect. And then press down. Okay, perfect. Okay. And then you remember when we did the thigh slapping thing? I'm going to get you to do that. I'm going to get you to start with like your right hand. Yeah, real fast. Okay, now do your left hand. All right, can you do them together? Okay. All right, I think we're coming to the end of our day, and my patience is wearing out for me. So I believe that I've covered everything from head to toe. Do you have any questions for me?
No.
Okay, I need to palpate your back again real quick, I'm sorry. Or percuss. Okay. Thank you, sir, very much for your help this term, and like all the rest of the times, payment will be due in 3 to 5 business days. Thank you very much.